This is your Command Flu Center. We've been working with the CDC and top hospitals across the country to answer your most critical questions. And most importantly, tell you what you can do right now to avoid this potentially deadly virus. Flu season. It's quickly spiraling into a public health crisis.
Another spike in flu cases.
Health officials are warning Georgians about a spike in flu cases.
And they say we could see another increase over the next few weeks.
One taking its hardest toll on children. So far, the CDC has reported 37 pediatric deaths, a number expected to increase throughout the season. Doctors are also concerned for baby boomers, who now have higher hospitalization rates than their grandchildren. But the deadly flu strain is also a threat to those outside normal risk categories. Like this California mom, a marathon runner who died at age 40 from the flu. According to officials, schools in at least 11 states have closed as flu-related visits to doctors and hospitals continue to skyrocket. Now, pharmacies are reportedly running out of flu shots as fears of a potential Tamiflu shortage escalate, leaving people worried as to just how bad this flu season will get. Now, I'm joined by a group of trusted medical professionals in our Flu Command Center. Dr. Jennifer Caudle is a family physician and medical journalist and has been reporting on the health crisis. Dr. Ian Lipkin is an infectious disease expert from Columbia University. He's known as the virus hunter. And Dr. Samson Davis is an ER physician on the front lines, treating patients with the flu every single day. Thank you all for being here. Dr. Lipkin, you fight viruses all the time. Why is this year's strain worse than in past years? Why was I able to show, and the CDC just confirmed, that the levels of virus transmission this year are higher than they have been in years?
Your response to influenza virus, and there are many influenza viruses, is really determined by the first influenza virus you see as an infant or as a young child. You imprint on particular series of types of viruses, and you develop immune responses, and the H3N2 virus is a virus that's very unlike what baby boomers and others have seen in the past. So it really is new for us, and as a result, we really don't know what to do with it. Our hope is we're going to come up with alternative ways in which we can rejuvenate those responses so that people can make antibodies, and there are a number of strategies for that.
So in the meantime, Dr. Carr, we're seeing a lot of kids, young children, getting admitted to the emergency room in alarmingly high numbers. Why?
Right, and pediatric deaths as well, which is so sad, and I think that it's kind of really a wake-up call for all of us. You know, there's probably a few reasons why we're seeing this. In previous years, we know that 80 to 85% of children who died from flu-related complications were unvaccinated. They were unvaccinated. This is previous years. We don't have numbers for this year. But based on those numbers, we suspect that that may be some of what's going on this year. So that's one of the things. And finally, with children, you know, the little ones, their immune system is not quite as developed as those of us who are older. So that also probably plays a role in their ability to get sick.
Dr. Samson, someone watching right now has got a sick member in their family with the flu. What should they do? Should they get Tamiflu right now? What are the protective strategies?
Well, first thing, don't panic. If you have medical problems, heart disease, if you, especially if you're pregnant or if you're elderly above 65 years old, then you want to take precautions and maybe take the Tamiflu as a prophylactic measure. But at the same time, you want to monitor your symptoms. If you're not having fever, body aches, joint pain, just because you were exposed to it doesn't mean you're going to contract it.
So let's just spend a second here and catch you all up on flu versus the common cold, because there's probably some confusion in your minds right now, so I'm gonna walk you through this. Colds, the symptoms are mainly in the head, congestion and sneezing. You'll get a sore throat. I'll put them on the list behind me so you can read them off real carefully and share this wisdom with everybody around you. The symptoms appear slowly over a couple days, and when you get the flu, it's very different because it affects your whole body, not just your head. You get pain and body aches, you get intestinal issues like vomiting and diarrhea. Worst of all, you get a fever, and it comes on quickly. I think it's probably the easiest way to tell them apart, right? Fever suddenly coming on, pretty significant, 101.5 to 102, that's what you got. Let me talk to Dr. Lipkin. You're renowned in our field because you're the virus hunter. You're the guy who always seems to find these crazy viruses first. What do you do personally when you see a flu season like this?
I wash my hands frequently. That's the first thing. And if I'm traveling someplace and I'm touching doorknobs and subway poles and things like this, and I can't avoid doing that because I don't want to fall, I try to wear a glove. And if I can't do that, I don't touch my face or my eyes. Because unless you touch your eyes or your nose or your mouth, if it's just on your skin, you're not going to get infected.
We've been touching our faces since we've been here. I've been noticing, by the way. Maybe I'm making you nervous. So, Dr. Davis, if you got a child, spouse, someone who's sick in the house, what do you do to protect yourself? How do you take care of their flu and prevent yourself from getting one?
Yeah, I mean, I'm seeing it now in the emergency department. Yesterday, I was working and inundated with just the flu itself. But at home and at work, as mentioned, I wash my hands frequently. If you can quarantine your child, I know it sounds kind of cruel to do so, but the closer contact you have, the higher chance that you will contract the flu yourself. It's important to instruct anyone in your home to cough in the crook of their elbow. And then those high germ areas within your home, the countertops, the doorknobs, the sink, you want to make sure you disinfect and clean those areas as well. Very important.
So, Dr. Caudle, you say the best way to do this is for people who are sick to stay home. So come on up. Let's just share some insights here, because at home you don't have a choice, but at work you do have a choice. You can do a favor to everybody else by not getting them all sick. So I'll walk them through the symptoms, then we'll give some advice. So day one, let's say you get infected, right? The virus enters your body. You don't even know it, right? But by day two, you're already contagious to other people. So,
even without symptoms.
Even without symptoms. So there's already a day here. That's why the virus is so smart, so clever. That's why people like Dr. Lipkin become virus hunters, because these guys are devilishly able to survive and pass themselves along. So you're infecting people for 24 hours without knowing it. But here's where the problem starts. Days 3, 4, 5, 6, you have symptoms. You have the high fever, the muscle pains and aches. You know you have the flu, but you want to man up, woman up, go to work, go to school, right? Power through. So you go in there and you cough in your hands and you touch a table and someone else touches it because it lives there for hours. That same virus. And now you pack all these people around you getting infected for these days. Finally, on day 7, on average, day 7, you're no longer contagious. And then day 9, 10, you actually start to feel like you're finally going to make it through. You're not feeling as tired, although that could have been lasting for a while longer. So
that's true.
Concrete advice I want everyone to repeat to each other. How long after you've had the flu can you go back to work?
First rule of thumb is if you're not feeling better, listen to your body. You shouldn't be going to school or work. But according to the CDC, you should not go to work or school if you have a fever. In fact, you need to be fever-free for at least 24 hours, and that is without the use of fever-reducing medicines. So you can't be using acetaminophen or ibuprofen to reduce that fever and go to work. You've got to be fever-free. So that's the gold standard. But I say listen to your body, because if you're still not feeling right, you shouldn't be going back to school. You shouldn't be going back to work.
Oh, thank you, Dr. Caudle, to my experts over there. Thanks for all being here. Finally, my biggest tip of all, I want to encourage all of you to get 7 hours sleep a day. That's my personal secret. And I think it's pretty good evidence that it's probably the best way to get your immune system back to where it needs to be. It's free. It's yours. So especially this time of year, take advantage of it. 7 hours a night. Be right back.